And, you know,
what do you think then? I mean, we're told you can't get this airborne, but yet, to your point, I'm seeing these guys roping around in hazmat suits and everything else, and I'm thinking, well, even with hazmat suits, when a couple of these guys are getting it,
yeah.
What's going on?
Well, viruses can undergo mutation, and they can mutate to a more virulent form, which can be transmitted in other ways. I'm not saying that this has happened already, but it certainly is a potential. And our policy should be directed against worst case scenario, not against best case scenario. When we're talking about the health and well-being of the population of the United States.
Well, then explain that to me, doctor. I mean, when you say some viruses can mutate, and a lot of plagues have happened that way, but I'm not saying that could happen here, but how likely on mutations, how does that happen?
Well, I would leave that to a virologist, honestly, on this particular...
Is that what they're called,
a virologist, on this particular virus, and how likely it is to mutate, and what the history
But there is
of
precedent
is.
for
But
it.
there definitely is precedence for it, no question about it.
What do we do, doctor, in the meantime? A lot of people get skittish, they get concerned. I always try to present both sides of the equation. Doctors who aren't worried about those who say we should do this, that, and the rest. What do you think we should do?
Well, I would recommend to everybody that they gain some basic knowledge of Ebola. Do a little bit of reading. You'll discover that this is a virus that generally is transmitted in bodily liquids. So sputum, vomitus, urine, that can transmit in the feces, various places. I mean, you need to know that first and foremost. You also need to know that that virus can survive for several days outside of the body. So if there were a container of contaminated urine and somehow it managed to find its way to someplace, a lot of damage could be done.
Now, that would be a stretch for a series of events to make that contagious, or would it?
Well, again, I say you have to always guard for the worst case scenario. So, you know, someone comes up to a lab worker, he knows he's got the urine. How'd you like to have $1 million? A little transaction there. I mean, somebody's going to say, that's crazy, that could never happen. Such things have been known to happen. We have to guard against worst case scenarios.
And you don't think we're doing that yet, bottom line?
Well, obviously we're not. I mean, we could easily have sent a properly equipped airplane. We have medical ships. We have various things that we could use to treat individuals and then bring them back home when they're no longer even possibly contagious.
Dr.Ben Carson, thank you very, very much. In the meantime, a man is dead in Saudi Arabia after being tested for Ebola as the World Health Organization opens a 2-day emergency meeting on this deadly disease. One panel will be exploring the use of an experimental drug cocktail that is showing some promise in treating 2 Americans. It is called ZMapp. Dr. Erica Sapphire is leading that project. Doctor, good to have you.
Thank you for having me.
So would you consider this a cure, doctor, or what is it exactly?
Well, again, I'm leading a large related project, but this was developed by ZMapp and USAMRIID and Public Health Agency of Canada, so they get the credit for the discovery here. Is it a cure? It's definitely a treatment. It's something you would give after being infected or even as a preventative. It's antibodies, and what antibodies are, they're molecules that your immune system raises to fight an infection. It's what you try to elicit when you give somebody a vaccine, but it can take days and weeks for antibodies to come from a vaccine. Now, with this one, we're delivering the antibodies immediately, so we're conferring immediate immunity to the patient.
So who is this being used on?
Well, this is early days. This was still in research, so Matt Bio and Public Health Canada and USAMRIID have seen that it worked very well in test tubes and in mice and in non-human primates. Now, the human clinical trial was scheduled for 2015, and that's going to go forward, but then this outbreak happened now. And so it hasn't been approved for human use because it hadn't come up for approval yet.
But have any requests, doctor, I'm sorry to jump on you now, but have any requests come from any of the patients or their families affected, or infected in this case, to try this?
I would imagine so. I don't really know because I'm not part of those chains of decisions. You know, I'm a PhD and I work in the lab, and my process is the research and discovery and understanding the mechanism. But some of the challenges of using an experimental therapy that hasn't yet been tested or approved is that the person receiving it really needs to understand what they're getting into, that this hasn't been proven and hasn't been tested, and there could be risks, and we just don't know. And so these two medical professionals, Dr. Brantley and Mrs. Reipel, obviously they have some medical training, and they know what they're getting into, and they know what an antibody is, and they know what it's likely to do.
And a lot of drugs like that, with potential vaccines, are attractive to those who fear that the alternative is more dire. Right?
Right, exactly. Your alternative is Ebola virus, so you might be willing to take some risks.
Gotcha. Doctor, thank you very much for joining us. I appreciate it.
Thank you.